Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, Village MD General Counsel.
Hi, I'm Janessa Nelson, the Legal Operations Analyst at Village MD.
This is our first Working Smarter podcast. In this podcast, we're going to give you compliance information, hopefully in a way that's concise, interesting, and relevant. So that's our challenge.
We're legal people, so we're trying to make this interesting to non-legal people.
The standard is not terrible. So, so today is an exciting day, not just because of our first podcast, but because we're so excited about some recent changes in physician payment by CMS. CMS every November releases a new physician fee schedule, a final rule. And this November, the rule was really directionally very favorable for the work we're doing at Village MD. And when you read the rule, it's almost like they're reading right out of our playbook. They're talking about the importance of primary care, managing complex patients in primary care, changing documentation requirements. So it's very, very consistent with what we're all about here at Village MD.
I mean, this would made really big waves, and I know that there's a lot of physicians who are worried about how this will impact their practice, so I think it's good to review them.
Yeah, it's good. We're going to give you an overview today and know that there's a lot more help available. If you're working with Village MD, just reach out, and there's lots of things we're going to be reaching out to you about as well. In general, we're going to talk about 3 major changes today. There are many, many elements to this rule. It's 2,500 pages. It wouldn't even make sense for me to list all the changes because there's so many, but the main things
it would just be a video of us listing the changes.
It would be kind of a scrolling thing. So that's not what we're going to do. So I want you to know the 3 things that are the most important that we're going to talk about. And one is changes to the E&M codes. The second is changes to hospital outpatient department, clinic visit billing. And then the third, there's a category of new codes for coordination of care and telehealth things that we're going to just update you on. Okay, so let's start by describing the changes to evaluation and management services. For those of you who may not know, evaluation and management services are sort of the holy grail of physician professional service billing, and it describes when a patient comes to a physician's office. The complexity is that there's a number of different levels of complexity or duration of that visit, and that's what we're going to really talk about is changing. Under the original codes, how they are now, there are 5 levels. Inexplicably, they've left off level 1 here, but
yeah, I bet it's not changing. That might be the reason why.
Level 1 is still, yes, correct. So what you can see that they're doing is they're condensing levels 2, 3, and 4 together. What does that mean? That means the documentation requirements, the back bends, the audits that we go through to describe the difference between a level 3 and a level 4, when this becomes effective, will no longer be required. So the payment is condensed, which may or may not be a benefit,
a good thing to you.
But the other benefit is you don't have to worry about, is this a level 2? Is this a level 4? You don't have to document all the medical decision making differences between, which in my opinion as counsel are very difficult and don't necessarily represent the way doctors make medical decisions.
That's true.
And it forces you, I always tell people, imagine if you had to write down everything you're thinking about to come to a conclusion. As professionals, we don't always know, we're not always able to do that. Now, in the final rule, there's some new things. Notice that there's an add-on code for primary care visits. And CMS is showing you an estimate here of what the amount is.
I think it's $13.
$13, right, thank you. This is really for primary care visits. It's not something that you have to do extra documenting for.
And I think half of what they were doing with the code merging together is to also allow for primary care physicians to have more variety of what they can see and what they can bill for, and so they're not getting penalized.
Well, the idea is there's a relationship that a primary care doctor is building with a patient, and that takes additional time.
Exactly.
The thing to know is there's an add-on code for primary care. Now, if you spend additional time with a patient, there's another add-on code to extend services, and that's noted in the next column 38 minutes.
For a new patient, and it looks like 34 minutes for an established patient.
That's right. Thank you. And so if you're spending additional time with a patient, that's a new code. And then you note here there's a current add-on code if you're spending 90 minutes with a patient, which is, I would imagine, quite rare.
Yeah.
But that code remains. So that's the highest level. This is a little bit complicated. We have some time. This isn't going to be effective for a while, but you should know directionally, this is where we're going. And this is great because this gets us away from E&M and focusing directionally on HCC and diagnosis coding, which is important when we go into full risk. This is a great directional change.
Also, it just is going to allow physicians to actually worry about treating their patients instead of worried about you need X, Y, and Z in order to get your code.
That's the hope. Really,
Yeah.
That's the hope. Another big change, and I can tell you this is going to be a significant change for hospitals, and this is effective immediately. So this was effective 1/1. And in a nutshell, you may know that hospital outpatient departments are paid under a different rule. They're not paid under the physician fee schedule. Even if it's for an E&M visit at a hospital-owned clinic. And there's a whole body of law about when is a clinic that's owned by a hospital considered outpatient department of the hospital. And there's a lot of things hospitals have to do to establish that. But the bottom line is many times they do that, and that allows them to pay physicians more because they get paid more just right off out of the gate for being an outpatient department. And CMS has been doing a lot of data analytics on this, and there's a lot of information they've gathered. They've been requiring hospitals to submit additional codes so they can measure the cost of this. They've done a lot of groundwork. They've been signaling for many years that this is all going to change. And what we're seeing as of 1/1/19, 30% reduction. Yes. Yes.
It's drastic.
And as of 2020, an additional 60% reduction. These are big numbers, and they're going to cause hospitals to have to evaluate, of course, their strategy in employing primary care doctors. Now, of course, this isn't the procedure codes. This is just for the E&M clinic physician visits. But there are other changes happening with procedure codes outside what we're going to talk about today. But it's important for Village MD primary care doctors to know this is very much supportive of the decision to work with Village MD.
Yeah, and it's helping out all the independent primary care physicians who aren't necessarily aligning directly with the hospital.
That's exactly right. You know, Janessa, there is a meeting here going on of all of our leaders. Wouldn't it be great if we could let's see if we can get someone to give us their impression of what these rules are.
Yeah, I think we should probably go talk with Tim Berry, our
Let's see if we
CEO.
can find Tim.
Yeah.
Hey, Tim, do you have a minute to talk to us about the CMS payment reform?
Hey, Rubus. Sure, I'd love to.
We've been talking about the changes to the E&M payments and the documentation burden reduction. What is your impression of these changes?
At Village MD, we have some really smart people who are analyzing the impact. But overall, I think it's fair to say that's a great time for physicians to align with Village MD. These changes validate our belief that primary care docs play the most critical role in changing healthcare delivery, reducing some of the burden of the documentation, and helping us move from the days of volume into a framework of value.
What do you think of the hospital outpatient department reimbursement changes, Tim?
I know it's going to be painful for a lot of hospital systems, but with that said, Village MD is working with a number of health systems and talking with many others about how to support their primary care practices. In general, these rules emphasize the importance of primary care in the community, and we are, of course, very supportive of that change.
That's great, Tim. Thanks so much. Do you have any final thoughts?
I'd say it's a good time to be a primary care doc in this country and a great time to work with Village MD.
Thank you so much for your time, Tim. So great to talk to Tim. I always love hearing his view. I wanted just to mention for everybody, these changes are big, and when the government makes big changes, they understand people need time to adjust. So what we're seeing, if you're watching along, is some guidelines on when these become effective. So the E&M payments are effective 2021. Along with that is the primary care add-on that happens at the same time. Hospital outpatient, as I said, right away, but it's scaled up. It's phased up. Some of it's now. There's other new codes for physician care coordination for telemedicine, and those are all effective immediately as well.
Yep.
As of right now, it's a great time to be working with Village MD. Lawyers and marketing, I don't know. It's a little marketing. Speaking of marketing.
Speaking of business and marketing.
Because everybody's here, let's see if we can grab Paul. I love hearing his opinion.
Yeah.
It's hard to get him because he's always on the move, but maybe we can grab him and sit him down for a minute and hear what he has to say about this.
Perfect.
Hey, Paul, do you have a minute?
You know me, Wendy. A minute can be 30 seconds or 10 seconds.
Well, if you have just a minute, we're here today talking about the new final CMS rules on physician payment and hospital outpatient department reimbursement. It's hot off the press from CMS.
You're right, it's hot off the press. This is big news in healthcare. Let me tell you, if you put yourself in the position of a physician, these guys are just trying to think about what's happening in their world. They're trying to rethink their strategies. They're not sure exactly what's happening. And this is where they could really use the help of somebody like Village MD.
It's got to be one of the biggest changes I can remember since I've been practicing. And the changes are so closely aligned with the work that we've been helping physicians prepare for. What is your opinion, Paul, of these changes?
So I'm just coming up the learning curve on them myself, and I have to say that this is a big deal. My opinion is the guys at CMS that are thinking about these changes, these are smart people, and what they're really trying to do is they're trying to help physicians go back to what they're really good at, which is taking care of their patients. They want to reduce the burden of paperwork and documentation and really get about taking care of patients. So I think it's a good strategy and a smart one by CMS. All right, Wendy, you can see my phone is ringing here. It's time for me to go. Keep going, keep going.
Thanks for joining us, Paul. We hope to catch you again. Paul is a whirlwind, isn't he, Janessa? He's going 100 miles an hour. But it's great that we could catch him.
I mean, there's a million things that are on this new rule. So we're just going to cover a couple more
just
extra
reinforcing.
things.
So yes, we said there's an add-on time for the primary care. We also mentioned the extended visit. Just a note about the coordination of care. There are new codes in this rule for time that you spend talking to other physicians. And there's a number of codes and they have to do with the number of minutes. So the idea is this recognizes that if you have complicated, complex patients, a big part of making sure they're well and healthy and safe is talking to the other specialists that are on their case. And so this will allow you to bill. Now, the downside of this, as I was talking to because I was like, this is great. And then I was talking to other people and they said, well, the patient is going to get a bill. And so there are going to be physicians who feel reluctant to bill them for that.
Based on their population.
And the government recognizes you're going to have to tell patients they're going to get billed for that. And that raises all kinds of other questions about how you're going to do that. But let's just say the time that you're spending coordinating care is so valuable. It's undervalued in our current system. Right now, it's bundled into the E&M visit.
And primary care physicians more and more are trying to coordinate care for really complex patients.
That's the thing. Yes.
And they're not
we want
seeing
them doing
any,
that. We want them doing
exactly. They're sort of the central hub. And before, they weren't receiving any financial benefit from being that central hub. And so now the government's trying to assist with this in some ways.
It is complicated because it can't be, if you saw the patient within the last couple of days, it's not an add-on. There's other requirements to it. And if you work with Village MD, we're going to be helping you understand these, and we'll do additional trainings from our department on these. But know that there are additional codes for talking to other physicians. And also there's codes for if your patient calls you and they say, hey, do I need to come in? Is this a thing? And you don't think they need to come in. So you haven't just seen them and they don't need to come in, but you can do something with them over the phone. You can now bill for that. Again, you have to tell the patient, and personally, as a patient, I would love that because I don't actually want to come in if I don't need to. Yeah. But of course, patients are going to have all different views of that. But that's a new opportunity. Again, recognizing the complexity of being a primary care physician and all the different ways that they communicate with patients.
And then the last one, which is probably the biggest alert that we can give for this little
Yes, I'm raising my hand here to tell you about Modifier 25. Now, don't turn the podcast off because I realize this is a sensitive subject and people use Modifier 25, which is a way of saying I had a procedure the same day as a visit. No. And it allows you to add on to a visit if you did a procedure. In the proposed rule, this was going to be totally eliminated. Why? They believe that this is being abused. And we're going to be putting out another conversation about Modifier 25 later this year, but there are specific requirements of Modifier 25, but the bottom line is it should not be the vast majority or all of your visits have a Modifier 25. If that's how you're using it, you're probably using it wrong. And so what they're doing is they're signaling here that enforcement is a priority for Modifier 25. And in fact, we know that there are probe and educate letters going out to people on overuse of Modifier 25. So they did not eliminate it in the final rule. They've scaled that back, but it is a warning. to everyone to take a look at your usage and make sure you're using it right. So that's the only like little negative thing.
So we just have some key takeaways just to take something with you as you leave and go back to your patients and your practice.
We always like to leave you with one page. If you zoned out and you don't remember what we said, or if you just want to have something to share with our Working Smarter podcast, we always leave you with one page. This is what you need to know. We won't read this to you except to say, remember that E&M codes are changing 2021. So you're going to need to know how to do that. So we're going to be working with our physicians, but just know you're going to need to get ready for that. There are also new codes for care coordination. There's some new codes for telemedicine. If you're using Modifier 25, be careful. And as always, it's a great time to be working with VillageMD. Thanks for tuning in, and we hope to talk to you about these topics again sometime soon.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.